Hi everyone, thank you so much for joining us today. We are running this session and it is entitled Nursing, Helping You, Helping Others. So just checking you're in the right session. So we'll be talking to our speakers who work in various different roles within nursing and midwifery. This is an interactive session, so we do encourage questions. So in order to ask our speakers questions, please use the Q&A function on your screen, and we'll hopefully get round to answering most of your questions at the end. And you can direct questions directly to a panel member, or it can be more general and we will work out who answers. If you can't find the Q&A button at the bottom of your screen, it may be in the left-hand corner if you're looking on a mobile phone. So firstly, I'd like to welcome our speakers and introduce them to you and get them to tell us all a little bit about their journey to their current career. So first off, we have Alina Satakangas. So I'll hand over to you, Alina.
Hello, hi, I am a midwife and I work at the Royal Free Hospital, and I currently work in a practice educator's role, which means that I coordinate student midwives from the Middlesex University, their clinical placement here at the Royal Free, in on-labour ward and in community.
Thank you very much. So then I'm going to hand over to Amita Shah. If you'd like to introduce yourself, that would be great.
Hello everyone, my name's Amita Shah and I'm a registered nurse as well as a district nurse by background. And currently I work as the lead nurse at the Barnet Clinical Commissioning Group and the training hub, which means that I have a strategic role over the nursing education side of things. So I work with the commissioners to find out what our population health needs are. And then I work with GPs and universities to put on programs which are suitable for nursing workforce so that they are educated in a way that fits with our population's health needs.
Great, thank you. And then I'm going to pass over to Jackie Hodgson. If you'd like to introduce yourself, that would be great.
Hi everybody, I'm Jackie Hodgson. I'm a practice nurse practitioner, and that means I work in a general practice, a GP practice. I have been working in Barnet area for a long time now. I started off my journey as a nurse in hospital, but very soon worked in primary care. Yeah, I think, oh, I'm really sorry. There's my dog. I told you he'd come in. I'll talk to you a bit later on about further questions.
Great, thank you. No worries. You can bring your dog in if you want as well. It doesn't matter. Pets are allowed. I'm sure many people here are watching with their pets as well, so it's absolutely fine. So moving on, we've got Hutong Zhao. If you'd like to introduce yourself, please, Tong, that would be great.
Hi, I'm Tom, and I'm a physician associate working in Enfield area, and I'm also the physician associate ambassador for Enfield and Barnet. So just a quick background on what physician associate is. So physician associate are a very new healthcare professionals with a generalized medical education, and we work alongside doctors, surgeons, nurses to provide medical care as a part of the integrated part of the multidisciplinary team. My background is nursing, so I did my nursing training first. Then I became a physician associate and pursued a medical pathway. Thank you.
Great, thank you so much. And then we've got Sophie Christo-Delou. Would you mind introducing yourself, please?
Hi, I'm Sophie. I'm a nursing associate and I work in a GP practice in Barnet.
Thank you. And then we've got Kathleen Jewson, please.
Hi, so I've got my dog here as well, so if anybody else has got their dog. So my name's Kath. I am by background, I'm an A&E nurse. I currently now tend to just work as a contractor and work on projects. So use my nursing training, my nursing skills, and do projects. So my current project is a nurse education project, and that's a 6-month nurse educator project working with the care homes across Barnet. And that finishes in May, and then I will move on to do something else. The nice thing about nursing is that once you've qualified, you can specialise in the area that interests you. And for me, that was accident and emergency. And then you can carry on and pick up all sorts of different diverse pieces of work. So I've done lots of different things recently, including prison, GP practice, and I still work in an urgent care centre when I'm not doing a project.
Amazing. Sounds like you've got a very, very busy work life. Yeah. And then we've got Maria Luengas. Would you mind introducing yourself, please?
Thank you, Sophie. Hi, everyone. My name is Maria Luengas, and I am also a nurse educator in the community. I work across North Central London, delivering clinical training in residential and care homes. And at the moment, we are rolling out a really amazing project, which is implementing remote monitoring in homes. So I'm quite proud because I can say that nurses can be involved in IT and we can bring new technologies to the community. By background, I am an ITU nurse, and I used to be also a clinical manager in the community for a private company. And I reiterate what Kathleen said, that the good thing about nursing is that you can really reinvent yourself as many times as you want, because the possibilities are endless.
Great, thank you so much. And then finally, we've got Orla Hillary.
Yeah, hi, my name's Orla. I'm also a nurse by background, and I actually trained at Middlesex. So I became a nurse at Middlesex University, and then I specialised in ITU, so critical care nursing, and I've been specialising in ITU ever since, and it's been obviously very busy for the last year.
Yes, definitely very, very busy. So Orla, I'm going to carry on speaking to you. So first question is, when did you decide what area you wanted to specialise in?
So one of the really exciting things about nursing when you're training is that you get a variety of different placements, and they range from a short 2 weeks to a long 3 months in the end of your training. And I was lucky enough to have 2 placements in intensive care. One was in my second year, and that was for about 5 weeks. And then one was in my third year, which was my management placement, which was 12 weeks. And I just loved ITU from being a student. I just loved the pace of the environment. I loved the how much care you got to look after your patients. And when I was actually in my third year, I asked if there was any opportunity for me to stay on here as a nurse, as a staff nurse, and I went for an interview, and then they kept me on. And it's very unusual to take students straight from a degree level, but because I had my management placement there, I got on really well with the team, and I really showed that I wanted to work there. They kept me on as a staff nurse.
That's amazing. Yeah, really inspiring. So I'm going to move on to Amita. Could you tell us how many areas you get to specialise in, or get to try out before you specialise, and is it the same everywhere?
So nursing is a 3-year degree program if you do it full time, and 4 years if you do it part time. And there are 4 areas that you choose. You have to decide right at the outset whether you want to be an adult nurse, a children's nurse, a mental health nurse, or a learning disabilities nurse. And then you follow that program for the 3 years. But like Ola said, in whichever field you choose, you would have lots and lots of opportunities to have various different practice placements. And so if you chose, like I did, the adult branch, you would have placements in the surgical ward, in theatres, in A&E, in a short time in mental health as well. You might have a placement in community where you'll be able to work alongside other community nurses as well as practice nurses. So depending on the program you choose, your placements will be relevant to that. So similarly for a pediatric nurse, they would have placements in a hospital as well as a community to become a children's nurse. And for mental health, they tend to have fewer sort of physical health placements and more psychological health placements. And learning disability nurses, similarly, they would have adult general placements, but more specifically tailored to learning difficulty clientele. And so basically, it depends what area you choose from, and then over the 3 years, you get a lot of choice to decide what you would like to do. Like Orla said earlier, she preferred ITU right at the outset when she had her first placement, so she decided to go there again in the 3rd year. And similarly, in an adult branch, you can do the same. If there's one particular area you really enjoyed, you can ask for some later on placements to be in that area. And in general practice, a 3rd year placement would be an ideal place, because if their general practice has a vacancy, just like Orla had an opportunity, they would employ you as a practice as a nurse, and then they would train you up to specialize as a practice nurse.
That's very comprehensive, thank you. And I think people will definitely appreciate knowing a bit more about that. So Kathleen, you've also had quite a varied career. Would you have anything to add to that?
I think, yes, you qualify as an adult nurse, and there's nothing to stop you changing your practice route. So when I first qualified, I was absolutely only ever going to do orthopedic trauma. So I was only ever going to look after people with fractures following road traffic accidents, trauma, that sort of thing. And I did 6 months, took a job in A&E because I thought it would help me further my orthopedic career, and of course got into A&E and decided, wow, and I stayed there for 13 years and didn't leave. So you can, but then after that I've managed to branch out and do other things, such as retrain as a health visitor, go back to university, do a management qualification. So the thing about nursing is, yes, you qualify as an adult nurse or a children's nurse, but throughout your career, when things change in life, there are always more opportunities and doors open for you to take a different path should you decide to do that.
Thank you very much. That's really inspiring for people to know that actually they don't have to just be kind of like dead set on something. There are options to move around once they have that qualification and experience. Great, so I'm moving on, and this question is for you, Jackie. So how easy is it to train as a practice nurse?
Just a little bit of background. When I first started training, I trained at the Royal Free Hospital in London, and you used to, oh, I'm really sorry. I'm going to move. So you used to have to work on the wards for a couple of months, and then you go back into school, and then you do some university work then. But things have changed a little bit now. Now you do your degree and you have placements, as Amita was saying, in different areas, different places. But to qualify as a nurse, you've got lots of different pathways. So if you weren't as academic as somebody, you could start as a healthcare support worker and get a role as a carer. And then you can do some further qualifications and move up the ladder. And I know the Middlesex has the opportunity of running the trainee nursing associate program, which I know Sophie in our local area qualified through that, and that's the route she took. So when I qualified, I used to work in intensive care for a few years, but then sort of stumbled into practice nursing as I did a locum maternity cover for a couple of, well, it was supposed to be a locum maternity cover, but I ended up having my children at the same time. So I ended up staying there. So I've now worked in general practice for 25 years. And it's just the most amazing area to work. You're looking after patients on the health promotion side to support them, prevent them from getting ill in the first place. And I've branched out and done various different courses along the way: asthma, diabetes, family planning. I'm also an educator, and I'm a non-medical prescriber. So I've just sort of added to my sort of little portfolio as the others have alluded to.
Great, really helpful. And I think that answers a few of the questions that have come in on the Q&A around how you train for these various roles. So yeah, we've answered quite a lot of questions. Great. So now over to you, Tom. How and why did you make the move out of nursing to become a physician's associate?
So again, to become a nurse really opened a lot of doors for me. So you can either become a physician associate, you can become an advanced nurse practitioner, and you can become really whatever you want to do. It really opens a door for you. So the reason why I went on to take my physician associate training was because I was always interested in the medical side of things. And I always was interested in human science and healthcare. That's why I initially started my nursing. Then soon after I started my nursing training, I realized I actually enjoyed more when I was watching ward round, when I was watching how patients were assessed and diagnosed, and how the investigation were carried out, and how people were treated, and how they got better, what treatment actually did what to which type of patient. So I was more interested in that part of things than the usual nursing care. So then I actually realized, so my thought become stronger after I became a qualified nurse working in the general hospital through A&E and cardiac unit. So I really learned a lot from being a nurse, but those really embedded my sort of becoming a part of the medical team. That's why I pursued my PA training. So to be able to do what I wish to do, for example, assessing, diagnose, and managing patient, I carried out this 2 years intensive training as a physician associate master course. And now my daily activity, so now I work in a primary care setting, in the GP setting. So my daily job involves I see patients face-to-face, telephone consultations, and talking to patients with simple or complex problem. For example, acne and cancers, and also depression, anxiety, mental health, a variety of different things. And you're trying to help them to figure out what actually is causing the problem, and what investigations needed, and what management is needed in those different cases. And then I do love my job, and I think it's a great opportunity for people who wish to pursue a medical pathway after their nursing training.
No, it sounds like a really great job. You're really helping people in a variety of different ways, which is amazing. So thank you for that answer. I'm now going to move on to Sophie. So what did you do before becoming a nursing associate, and do you plan to qualify as a nurse someday?
Yeah, so I didn't actually go into healthcare till a lot later on. So I think it's after having my children that I realised that I wanted to go into healthcare. So I started as a receptionist in a GP surgery. I then moved on to be a healthcare assistant. And from then, the apprenticeship programme came around, which was funded. And it was a way of me developing my skills and knowledge by attending an apprenticeship program, but also getting paid a salary to do so. So it really suited me with a young family. I always knew that I wanted to help people and to make a difference in people's lives. So it's really given me the opportunity to do that. I think the good thing about this apprenticeship program is it's got a lot of flexibility. So I've qualified as a nursing associate, but now I can have a break if I wish, and I can do an additional 18 months to qualify as a full registered nurse if I wish, whenever it's right for me.
No, that's fab. I think, yeah, what you've said there around the apprenticeship program, it's really important for people to know that there are a number of different routes for them to go into to pursue whichever career it is. And you're doing a higher level apprenticeship, and there are also degree level apprenticeships within nursing that people can also go into. yeah, do you love your apprenticeship? Is it really kind of exciting, and you're kind of out on you're working, aren't you, as well as studying, so it's a nice way to learn, I imagine. So I've got a question now for Elena. So what is the best thing about being a midwife, and did you qualify as a nurse first?
So, best thing, not only that we witness miracles every day, which is still after 20 years, it's quite amazing, to be honest. But what I particularly like in the midwifery practice is that we midwives, we get the special connection with the family, the woman and the family within very, very short period of time. And we get so close to those people in the special time of their life. Whether it is very happy moment or it is maybe sometimes sad and scary moment, but it's really, really, it's quite a lovely feeling. And I also like to work on a very busy, on labor ward, on a busy ward when there's a good team, and I'm sure many of my nursing colleagues as well. It's a lovely feeling, even though you are busy, and especially these times, but you have your colleagues to back your work. And midwifery is very autonomous, so we make decisions on and work in our, like, the rooms that we look after the ladies, or at home. So it could be that the lady never sees any other health professional during pregnancy and birth, and after birth. And of course, working with the doctors, again, that teamwork is really, really vital, and I really enjoy it. And then my route, I very long time ago, as I mentioned, I did, it was a direct entry, and I didn't train as a nurse first, so straight into midwifery. But we had loads of nursing placements, so I really loved A&E and cardiac wards and psychiatric ward, and wherever we went, I thought that I could specialize in all of those before really went into midwifery.
Great, thank you. Sounds so rewarding, and I think, but yeah, all of your roles are extremely rewarding in some way, aren't they? So yeah, it's really lovely to hear how much you all enjoy what you're doing. So I've got one more question, and this is around the current situation. So we know that this year has been really difficult for everyone, let alone all of you that work within the NHS, and you know, we are so grateful for everything that you've been doing during this time. Maria, could you tell us a little bit about how COVID has changed your role, and talk about any of the changes that have come into place, and whether you think that these changes might continue once the pandemic is over?
Yes, so it's because of COVID that my team and I are at the moment running this project of remote monitoring. So because of the situation in the homes is when this need of offering them more support has come, and that's where we got the funding to roll out this project. So I think that's been a really positive aspect of the pandemic. Without that, we would probably still be doing things the old way. And we really believe that because of this project, people are going to be safer in the homes, and it has also allowed us to upskill the staff in the homes. So that's been positive. The drawback of the pandemic, it's been that we've been forced to work remotely. And I don't know the idea that many people have about clinical education, but my idea has always been on the floor with the staff, be hands-on, support them, do face-to-face teaching. And all of a sudden having to sit down in front of my desk, in front of a camera, it's been really challenging. I've had to quickly get upskill in IT. I've had to be really innovative and think of, okay, how can I engage with people better? I think I would have never thought that I was going to be recording tutorials just to make things easier for everyone. It's particularly challenging when you have to teach practical skills. And it's particularly challenging when you know that people are struggling and you can't be there to support them face to face. It becomes really impersonal sometimes, even if you really try your best. The good thing is that I think we've realized that some of the training can be delivered in the way of webinars, like is this case. You can reach more people if you do a webinar. People can access from the comfort of their own homes with their pets, a cup of tea, a cup of coffee. It's readily available really any time of the day. They can watch it again if they wish because the sessions are recorded. But I think I think some of the training will continue in that format, but but some of it will go back to face because we are realizing that we can't live without that. We are humans. We need that contact. And if you really want to be able to support someone and assess, you need to be on the floor with them. You can't do it from home.
No, absolutely. I actually had another question to ask Sophie. As you are currently within education, have you seen that your kind of learning has been changed due to COVID in the ways that kind of Maria touched upon there?
Yeah, so I finished my training now. So I've qualified in December, but we was obviously due to COVID, all our lessons. So I studied with Middlesex University, and we were all online based classes. So it's obviously quite difficult to use technology to try and adapt to that way of learning. But yeah, it's definitely, it is difficult, but it works. And sometimes it works really well. So yeah, it's definitely changed it.
Yeah, I definitely think it's allowed everyone to upskill in ways that they didn't know they could or maybe needed. So from what you said, Maria, around like the kind of technological aspect, and actually in innovation as well, you know, there are, and some of the projects that the project you mentioned, that wouldn't have happened without this situation happening. So whilst there are some negatives, there have been some positives that have come out of it as well. But I'm sure you're all wanting this to kind of be over so that you can have a well-deserved break and rest, because you've all been working extremely hard. And as I said before, you know, everyone's so grateful for everything that you're doing within the NHS. So we're going to open up to questions, and we aren't short of questions from people. So I'm just going to have a look. So a lot of people have asked about the best routes into specific areas. So is anyone able to answer a question around the specific route to go in to be a neonatal nurse?
I'm not obviously a pediatric nurse, but I can say some of my friends who are neonatal nurses, the way that they did it is they trained to be children's nurses. So they did the 3-year undergrad children's nurse, and then kind of like all of us, you specialize in neonatal nursing. So once you finish your 3 years as your degree, you can choose to go into the area that you want to. And if neonatal nursing is that, then you just pick an area or pick a job in that department.
Amazing, thank you. So we've got a couple of people that are stuck between doing a degree and maybe going down the degree apprenticeship role. So it would be nice to kind of get people's opinions on that. I know you can only talk really about your experiences and the particular qualifications that you've done, but I guess any advice around deciding which one you want to do would be helpful as well. Who wants to take this question? Amita?
I'll try. I think I think it's very much a personal choice and your personal circumstances. The end result will be the same. You will have a degree, whether you do it in a, the standard apply via UCAS and get a stamp, the normal place and do a 3-year degree that way, or go via the apprenticeship route. The apprenticeship route is, like Sophie said, you earn a salary while you're training as well. So that might suit your personal circumstance. Whereas the straightforward degree route means that you have to take out a loan to study. Although there is some talk about reintroducing the bursary for nursing programs. So I think it's very much what suits your personal circumstances. At the end of the day, you will come out with the same degree. One will take you slightly longer. One route will take you slightly longer. And you will be earning and learning at the same time. So what Jackie was talking about was similar to when I did my training. Although we weren't paid a salary, it was like a earn and learn sort of thing. You were part of the workforce when you were on your practical placement on the wards, depending on wherever you were. You were a nurse with the rest of your qualified nurses in theatres. So you learned on the job, and then you went to university or the classroom to study the theory side of things. So depends on your learning style, depends on your personal circumstance, but either way, you will come out with the basic nursing degree, which to me is a foundation to a whole load of opportunities. You should see that as just the stepping stone to a whole variety of careers, and they can span outside of health as well. They can go into social care, because my career took me into social care, where I was looking after family carers, people who actually look after their own family with long-term conditions, but are, have no training. So my role was to actually, support these carers so that they were not feeling isolated and not having any skills to look after somebody with mental health. And that was such a rewarding job. It felt like I was really making a difference. So the basic foundation degree is just a stepping stone for a whole variety of opportunities. You can go into airline nursing. So, I mean, it's just, the world is your oyster once you have those basic nursing skills, and you come out with a whole lot of communication skills as a result of doing a degree.
Yeah, totally agree. I just want to add on to your point around the bursary. So yeah, students now will get the NHS Learning Support Fund like bursary, which can go towards supporting you while you're at university. So if you're studying nursing, midwifery, or a range of allied health professions, which include things like mental health nursing, learning disability, radiography, podiatry, orthotics, you can get £5,000 to study, and that's per year. People may have seen the adverts that have been going around on the telly, which say about training within the NHS and getting that bursary. There's also regional incentives as well, and course incentives. So for particular courses that don't get as much recruitment, so things like nursing and midwifery, they get a lot of people apply to those courses. But for courses where they don't see a lot of recruitment, you can get an extra monetary incentive. There's also childcare incentives in terms of money as well, and a regional incentive as well. So for areas of the country that don't see as many people going into those particular professions, there's also a regional incentive as well. So yeah, but I completely agree with what Amita said around it being a personal choice. So lots of people would like to know if they were to go straight into the NHS, so to work within the NHS, doing something that maybe didn't require a university degree or a higher level qualification. Does the NHS provide opportunities to upskill within the field that you might go into? What that field is, I don't know from this person's question, but yeah, are there opportunities to upskill?
I'll take this one. So I obviously started as a receptionist in a GP surgery within the NHS, and this opportunity came about, and I was able to upskill and develop, and now have a registration with the Nursing and Midwifery Council. So definitely opportunity to develop by joining the NHS.
Great, thank you. We have got quite a few questions around specific course requirements. So for anyone who is asking questions around what sort of qualifications you need for particular universities courses, we do have the universities chat happening. The university representatives there. I'm just going to see if we've got any other. One around work experience. So for some university courses, there is the need for work experience. Whilst you won't be able to talk about each university and what that requirement is, do you have any recommendations for good work experience that people could try their hand at, or any virtual opportunities that you know that have come up in light of COVID? Yeah.
Yeah, I'm happy to take this one again if you want, or Alina, do you want to go?
I would, just because my role, lots of students come to me and ask about work experience, and currently we are unable to accept anyone here on all wards because of the limited number. But I would always tell everyone, especially if you're thinking about midwifery, or it would be good if you volunteer, and if you contact any hospital, you can set how many hours you want to do in a week or in a month, and or maybe a couple of hours every other Sunday or whatever you would like. And that would be and it's a really good way to get to know.
But also, there's also other ways that you can volunteer and get some work experience. Like before I went into university, I was in an Irish version of St. John's. It was called Civil Defence, which taught me lots of things to do with communication skills, how to do basic first aid, how to do CPR, which is all stuff that you'll see, when you go into a healthcare career. So even if at the moment you can't get into hospitals, tell them to volunteer for places like St. John's, apply for Red Cross, anything in healthcare that you can volunteer for will stand to you significantly when you go for an interview.
Yeah, you can
also I'd just like to add. Oh, sorry.
No, you go ahead.
I would just like to add, there are a lot of places, COVID vaccine centers, they actually really want volunteers to do meet and greet. So that way you get a lot of experience in actually communicating with patients who has special needs, for example, hearing difficulty or verbal communication problems. Then that way is a good way of volunteering at this moment, because there are plenty opportunities around the area.
Yeah, I was also going to say that you could sign up to be a dementia friend, and that's by having a phone call with a lonely person once a week on a regular basis, and you can apply to do that through Age UK.
That's amazing. I think that's really, really helpful for a lot of people that have asked this question and want to know more about the work experience opportunities available. So we are nearly at the end of our time that we've got, but I just wanted to ask one last question, and this is from one of our attendees. So are there any expectations that you had about your particular career path that you've gone into? Have you found that they've differed to the reality? And do you have any tips for people trying to get into their particular career? That's almost two questions in one, sorry.
Is it all right if I speak for this one? Only just partially. So I would really recommend, before you commit yourself in a long-term career, make sure you have even a tester placement or some voluntary experience in a certain area you want to go into. Therefore, once you commit, you don't feel like you're let down by what the job is required. And because you may find, for example, right at the moment you think A&E is very exciting, very interesting, full of adrenaline rushing, but when you're in that, you may not be able to deal with the breaking bad news and things like that. You may prefer like cardiac ward, who are more a bit slower in pace, and just this kind of thing. I would really recommend you to have a good few weeks of experience before you commit into a long career.
Has anyone got anything else to add?
I think the only thing I would add to that is, don't forget, nursing is so wide that you are not going to love every aspect of it, but there is going to be something there that just clicks. And the thing with nursing is, you might think, I absolutely thought I was going to be an orthopedic nurse specialist. And I'm sitting here working as a nurse educator with elderly care homes and couldn't be happier. So there's so many different things. Don't feel that you have to specialize too early. Find out what you love, but be prepared to change if it's not quite what you expected it to be.
Yeah. Can I just add to that? Because I think that's absolutely spot on. My career took all sorts of directions. I was absolutely passionate about care of the elderly, which is why I did district nursing. Thoroughly enjoyed it, but some opportunities came up which I thought, you know what, it's still along the line of my care of the elderly kind of end of life kind of stuff, and the family carers job that came up was probably the best job that I did. In fact, I was awarded a Nurse of the Year award, having done that for a very short time, because it was a project, and you know how it is with, sometimes it was just the right opportunity. So don't close yourself to opportunities. Once you're qualified and opportunity turns up, give it a go. You have nothing to lose, and if it doesn't work out, you've learned something you can take to your next step.
And also, I started my career in a hospital secondary care setting, and I could never imagine myself working in GP surgery in primary care. But now, since I've been working in GP surgery for a period of time, I love it, and I can't imagine myself working in the hospital again. So it goes where life takes you to, and the field is always changing. Healthcare is always changing. There will be plenty of opportunity coming up, even with IT, with more device, and with more technology treatment. You may really want to specialize in cancer treatment when the cancer treatment is more advanced. But things are always changing in this area.
That's so helpful, thank you. Has anyone else got anything to add before we finish? We've slightly run over time, so apologies for keeping you all a little bit longer than we'd hoped, but this has been such an insightful and inspiring panel. I think there's been some really, really good discussions. For those of you watching, we're just going to pop up a poll onto your screens. If you can fill this in, that would just really help us to get some feedback on how we can improve these sessions. Okay, so just wanted to say a massive thank you to you all for giving up your time today. It's been great to meet you and also know a little bit more about the particular roles that you are in and have also been in your time within the NHS. I think I can speak for everyone when I say this has been really, really helpful and, as I said before, insightful for those considering going into either nursing or midwifery.
Enjoy, good luck, be kind to each other, and see you at the other side.
Yeah.
Good luck.
Thank you so much. And for anyone else attending the other talks, they'll be starting shortly. Thank you.
Thanks, Sophie, for the opportunity. Good luck all.
You're welcome. Thanks,
Bye.
everyone.